Hi, my name is Omar Partida, and today we'll be doing facial and eye examinations. We're going to go ahead and start with palpation of the face. So when you palpate, you want to go ahead and use your thumbs. You want to palpate for any point tenderness, any deformities, skin temperature, and also while you're palpating, you want to go ahead and observe the face. So you want to observe for any discoloration, any swelling, any obvious deformities. So we're going to palpate starting lateral to medial, and we're going to start in the zygomatic arch. We're going to work our way to the nasal bone, around the eyes, go on the frontal bone, we're going to go ahead around the mandible, and lastly on the maxilla. And that's how you do palpations of the face. Okay, so now we're going to go ahead and do a general eye inspection of the eyelid and cornea. So what you want to look for the eyelid is you want to make sure that there's no symptoms of a sty, any lacerations, discoloration, any swelling. So you want to go ahead and observe. You want to go ahead and ask the patient to close his eyes for a quick second. Okay, so now you want to go ahead and move into the cornea. It's pretty much for the same thing as the eyelid. For the cornea, you want to go ahead and check that there's no lacerations, any discoloration. You also want to check for any hyphema, which is building of blood in the eye. Next, you want to also check for any clearness. You want to make sure it's clear, that there's no cloudiness. And lastly, check for any debris. When you're checking for the cornea, you want to make sure you pull down the eyelid. You also want to make sure you pull it up. And that's how you do a general eye inspection of the cornea and eyelid. Now, the next part of this examination is we're going to go ahead and do some eye tracking. I'm going to go ahead and use a pen light. I'm going to instruct the patient to keep his head still and only move his eyes following the pen light. I'm going to go ahead and move the pen light in at least 4 different directions. So go ahead and follow the pen light. And what we're looking for is making sure that the eyes are following the pen light symmetrically at the same time. Also, we're looking for any nystagmus. And that's how I do the eye tracking. Okay, so our next exam we're going to be doing is called the Pearl test, which stands for pupil, equal, and reacted to light. So what we're going to need is a pen light once again. We're going to cover one of the patient's eye, and we're going to instruct the patient to look towards the hand. And what we're going to do is we're going to bring the light towards the pupil, and what we want to see is make sure that the pupil reacts to the light by constricting. And once we move the light away, we want to make sure that it dilates again. So I'm going to go ahead and cover, instruct the patient to look. So when I did the exam, his pupil constricted, and when I moved the light, it dilated, so that's good. And we want to go ahead and do this on both eyes. So once again, look towards my hand. Okay. So this is how you do the Pearl test. Okay, so for this portion of the exam, we're going to go ahead and use an ophthalmoscope. Now, before using this ophthalmoscope, you want to make sure that a few things are correct and working. You want to make sure that the light is working and it's on. Next, you want to fix the settings. There are 2 settings you want to worry about. The first setting is the short focal length setting, and to do this, there's a set of green numbers. So you want to go ahead and move the dial to the right, and you want to see which setting is best for you. To do this, you want to place your ophthalmoscope around 3 or 4 inches away from your hand, and you want to go through the range of numbers until you find a clear number where you can see clearly your epidermis. The next set of numbers you want to look at are a red set of numbers, and this is for your infinite setting. To do this setting, you want to go ahead and place the ophthalmoscope. You want to look through it. You want to look at an object that's pretty far away in distance, about 20 feet. So what you want to do is you want to go ahead and look as you're going through your settings. You want to make sure you pick a number which you can clearly see that object. To examine the patient's eye, you want to go ahead and place your hand on the patient's forehead. And the reason you're doing this is so while you're examining the patient, you don't bump into the patient's forehead. What you can go ahead and do is you can go ahead and place your forehead onto your arm. So first we're going to check the short focal length. And this is for the cornea. This is going to be examining the cornea. So we'll go ahead and lift the eyebrow right here. Okay, so what we're examining for is any lacerations, any debris, make sure that it's clear and not cloudy. And our patient looks to be fine. And you always want to do this on both eyes. So now we're going to go ahead and move into our infinite focal length. So now we're going to be using our infinite focal length. And we're going to be looking at the optic disc and the retina, making sure that the blood vessels in the back are normal, that there's not any discoloration, any lesions, any scar tissue, making sure that they're the normal color. So I'm going to go ahead and check once again. Okay. Everything looks fine on our patient. When you're doing this exam, you want to make sure that you examine both of the eyes. And that's how you do an ophthalmoscope. So finally, our last exam is a visual exam, which consists of the Snellen eye chart. So what you want to do is you want to go ahead and ask the patient if they wear any contact lenses or glasses. And if they do, you want to go ahead and ask them to wear them while they take this exam. So you want to instruct the patient to stand 20 feet away from this chart. And you want to ask them to cover one eye. And then you're going to tell them to read the top line and work their way down. Normal readings is 20/20, which is line 8. So let's have an example. If the patient reads all the way down to line 7 and they can't read line 8, you will record the number next to it, which is 20/25, which means that what they see at 20 feet, other people see at 25. And then another example would be line 9. Whatever it says right here, it says 20/15. It stands for what they see at 20 feet, people see at 15 feet. And you want to go ahead and do this again with the other eye. And then one more time with using both eyes, and that's how you do a Snellen eye chart.